Several Singaporean officials have emphasized over the last week that we're preparing for the long haul and this pandemic could last through the year or longer. So I'd like to know a little bit more about what that means, that the pandemic may last a year or longer. Does that mean that we should expect to see a rise in cases, of a large number of cases over the duration of that period, or does that mean that you think this won't end until we get a vaccine? Thank you.
Thank you. Part of the factor we have to take into consideration is what is happening to the rest of the world. If the rest of the world is still having growing number of infection, then it is very unlikely for us to see a continued decline in number of cases or reach a zero case, because we are connected to the rest of the world. Even though we have travel restrictions, we have a travel advisory, but there will still be Singaporeans who will make necessary trips overseas, and we will still have risk of importation. We are just doing what we can to reduce the risk, and therefore, to a very large extent, you have to observe what's happening to the rest of the world. And at the same time, looking at locally, while we do our best to contain the infection and to see whether we can reduce local transmission, there will still be sporadic cases from time to time, because there will still be cases that are undetected and suddenly it occurs, and you can have a cluster like you have in SAFRA. So you would continue to see a number of cases, and in the short term, we do expect the number of cases to increase. It may reach a peak sometime later. When that is, again, depends on the rest of the world. And when it reaches the peak, we do expect to see the number of cases to begin to come down. And how fast it comes down depends on, again, several factors. It also depends on the extent of the immunity the population has developed. And some countries have adopted their policy their approach, their strategy to build up immunity so that, in fact, if many people have been infected, Germany, for example, has expected up to 70% of the population to be infected. When that does happen, we don't know when, but when that happens, the population has some form of immunity. But there's also a big question mark with regard to the sustainability of that immunity, because this is still a new coronavirus. The knowledge of the virus is still being discovered. Whether whether infection confers immunity in the short term or in the long term is still something that we still need to study further. And therefore, if we are able to develop community immunity, then the number of cases will begin to slow down. Or, as you mentioned, if we discover a vaccine, then the number of cases may come down. And if we discover an effective cure, then the total number will be reduced because we are able to cure them, and therefore there's the risk of further infection also will come down. So it depends on quite a number of factors. So as to when that will happen, it is too early to tell. But as I mentioned earlier, because of our strategies to slow down the infection rate, to defer the peak for as long as possible so that we minimize the stress on the healthcare system, because of what we do, in fact, we may extend the infection period. And we also have to bear in mind that even after the infection is over, the outbreak is over, we have managed to maintain it at a certain baseline level. There's still the economy impact that you need to worry about. I think PM has mentioned it before, that the economy will take a much longer time to recover, given that this is quite a severe impact on the economy, not only on Singapore, but on the global economy. So I think it will take some time for it to recover. So therefore, the entire episode and the entire challenge will take quite some time, may last beyond a year. So therefore, we have to prepare for the long haul. In the measures that we put in place, we need to think about how can we adjust it to a level that we can sustain for many months and not just for the next week or so. So I think this is the approach that we are taking.